Well, thank you all for joining us today. We are kicking off a series of compliance conversations here at Circa Behavioral Healthcare. And this first one, we're going to talk to our founder and CEO, Devon Wayt. So thank you for joining us today, Devon.
Thank you for having me.
I'm honored to serve as a National Compliance Director with Devon and the team at Circa Behavioral. So we're going to take this first session to just talk about Devon and why did he find this company of Circa Behavioral Healthcare, what we do, our mission, our vision, and the goals that we hope to accomplish in the field. Hopefully we'll talk about his story and how he got into the field. And then if we have enough time, we also want to get into where we see the field, where it's come from, where it's going, how we see compliance as a contributor to where the field will be in the future, and some of the important factors that we see in having compliance be the heart of the organization around well-being, the workforce and the workplace, and how that impacts the future of compliance. So Devon, first, if you will, just tell us kind of your story. What brought you to behavioral health and what brought you to finding Circa?
Okay, great. Yeah, thanks, Maeve. So what brought me to behavioral healthcare was me seeking services originally. I'm a person in long-term recovery, and that happened because I went down a not so great path and came from a great family, grew up on a 72-acre cattle ranch, kind of very small town. I think it was only 400 people. The town we lived nearby, there was more people, but and now it's like 800 at the moment. But I still found my way into getting into trouble and all of that. But what had happened was I moved from the small town in Colorado to Phoenix, Arizona to try to do graphic design school, and I wasn't doing well. I had was using alcohol and substances, and just ended up really not going to school and had a other slew of problems. So I was grateful my family stepped in, my friends, actually everybody came and did an intervention on me, and I went to treatment. And let's see, I was 19 years old when that happened, and I went through one treatment center for like primary care and then another one for aftercare, and the aftercare one was in California. And I ended up doing treatment here, and then getting some really close mentors. And unfortunately, I didn't get it on the first try. I did some things they told you not to, like get into relationships and other things. And so I'm one of those people that have to learn the hard way sometimes. So when I was 22 is when I eventually got sober, clean and sober. And the treatment center that I went to, which was really a last ditch effort. My family was done, I was done, and so I'd really hit the end of the road. But that particular treatment center ended up hiring me. And so that was in 2002, or no, it was in 2003 when they ended up hiring me, March 18th of 2003. I remember the date. And then I've been in the field ever since. So.
Wow, what an inspiring story. That's incredible.
Thank you. Mm-hmm. Yeah, so, excuse me, my printer buzzed here. I didn't expect it to do that. So,
good example of the work. The work never stops.
Yeah, right. I know. Okay, well, that's all now. So how Circa came about was I worked at one treatment center, that one, and that was out in Riverside, California, for 7 years. In about, I don't know, 3-4 years in, it was owned by a husband and wife couple. It's kind of a family-owned operation. They were really close to my heart because they had, helped me out so much and all that. They ended up selling to a larger corporation, which was a good thing for them. And a lot of people left. There's just a lot of turnover and different things. But I stayed on. I thought it was great. I got better benefits and got to interact with different people. And they had this quality compliance team that would travel throughout the U.S. and visited the locations. And I really connected well with them. And they said, hey, like collectively we decided with our program director and them that I would be the compliance person on site there, and that we needed to get CARF accredited. So they supported me, but I studied the manual and did all the stuff. And, when you're learning that stuff and you don't know anything, I just was really in over my head, but I enjoyed it, trying to figure it all out. I remember asking if I'd make more money. They said no. So
Make less, actually. Right.
yeah, it was just one of those, like, maybe one day if you can, get better at that. So, but we ended up going through 3 CARF accreditations. The reason, and if I could do it all over again, probably would have done it differently. But we got one, and then we added one service, and then we added another service. So we had 3 interactions with them. I got better each time. Plus, I was interacting with the state, so I really knew I enjoyed compliance. And so I had also kind of hit the top of where I could go there. I was the director of operations, and I put in a application to work for the same company, but in Newport Beach, and be a program director of a program down there. And another gentleman who actually owns a treatment center in Newport beat me out, to it, and he was way more qualified than I was. So he certainly won that battle. But what happened was I ended up taking a client to court, and I saw a gentleman that I used to work with, and he talked about another treatment center and said, "Hey, give me your resume." So I had that compliance stuff kind of worked into operations, and compliance worked into my resume. And I ended up getting a call from them, and it's a gentleman that I knew from that original treatment center, had left and purchased this one, and was owning and operating it. There's actually 2 people that I used to work with. So I knew them, and then they said, "Hey, we're hiring this hotshot CEO, and we'd love for you to come meet with him and see if you still want to, consider coming working at this organization." And I did. The new CEO was wonderful. He ended up being a dear mentor and friend of mine, and eventually business partner. And so I worked at that organization for 10 years, and became a partner over the last couple years, and just operated it and grew it from a certain amount with the rest of the team to where it was in 2020. And as a partner and growing the organization, I was doing a little consulting, not necessarily for pay. It was just with our strategic partners, and helping them out with state licensing or compliance, or how to better run their organization. So because a lot of them were considering selling to private equity, which would have been fine, but they actually didn't want to. They wanted to try to figure it out. So we were helping them, learn how to operate better, and so that they could stay afloat on their own without doing that. And I just really enjoyed it. It lit my brain up, and I loved all that. So when I ended up stepping away from that partnership, I knew that doing consulting full time was what I wanted to do, and that's how Circa Behavioral Healthcare Solutions was started. And so it's actually been around a while, but I really launched it as of 2020, and a lot of the people that I worked with at that treatment center, as you know, have come over and joined the team. I didn't steal them; they just came over. And
That's right.
so I've worked with the majority of our team, gosh, anywhere from 5 to 7 years. We've worked together for quite some time. So,
well, if you can for a minute, talk about the relationships. You talked about getting early into the programs you worked with, and sort of the mentorship and the guidance, and then you work with the same people, the same people, then you bring the same people over here. What's the importance of relationships and community in our field, do you think, as a workforce?
No, I mean, it's everything. Behavioral healthcare is stressful, dangerous, very rewarding. It's a roller coaster ride. So there's good actors, bad actors. So having a cohort and community, I think, is extremely important, in developing those relationships. The other thing is, this field isn't for everyone. And had I not had that great mentorship, as you know, and I'm sure you've had too, Maeve, I probably wouldn't have stuck around, but I had people that gave me the tools that I needed. I remember exactly one point, and this was, I was becoming a manager. I was learning how to be an operations manager. This was at the first treatment center. And I think naturally I wanted to do a very good job. and I wasn't that great at delegating. I was ultimately probably scared to ask people for help, and wanted to do everything on my own, improve myself, but I was a manager. And the cost of that was I was extremely stressed, and I'm in recovery as well. And so my our leader, who's a program director, and then the clinical director, they pulled me aside, I remember, and it was at a little 4th of July party that we had, and they could see it on my face, and I was just, something was gonna probably break. And so I was grateful they pulled me aside and they said, look, like, you've got to take care of yourself, B, learn how to delegate, and otherwise you're not going to make it in this field. So they actually sponsored me to get some therapy with a dear friend of mine who's he became a friend after our therapy sessions, but his name is Dr. Patrick McAfee, and he's passed away since then. But he gave me the tools on how to take care of myself and how to delegate better. And he actually referred me to the university that I ended up getting my master's degree at as well too. So it's just a great connection. He was another mentor that I had in my life. And had I not done things like that to take care of myself and see the bigger picture, then who knows what had happened. I don't know. I would have probably backslid in my career, or God forbid something else worse happened. But the right people showed up at the right time.
Lucky they showed up, and lucky that they were brave enough to say something, right? Because sometimes we have those thoughts and we know we should or we could, but then we don't. So it's great that they took that risk, that you would be open to it.
So I mean, that must have been 2008 or 7. But I saw early on that I really needed to take care of myself working in this field. Unless I did that, I wasn't going to be good for me, my family, or anybody, And so, so your original question around the community is it's everything, having that support, to help us through.
And it's kind of what we teach our clients, right? That they need support and they need a community and sponsors and mentors and mentees and all this stuff. But sometimes we don't practice it ourselves. So if we practice it, we might actually even do better care for those that we're serving, in our programs.
Right, exactly. Yeah.
Very neat. So you mentioned that you built this team at Circa. Give a high overview of kind of what we do at Circa and what the value that we bring to organizations that we work with.
Sure. Yeah. So our team, they're wonderful, and they have specialty backgrounds. So we have people that are great operators. We have clinicians. We've got human resource specialists. We have nurses that are skilled in healthcare. And when I started building the team, that just happened naturally. As long as we knew compliance, we knew we had the right team, but they just happened to have those diverse backgrounds. And I think what it was that was the team that I worked with at the treatment center. And so we all knew each other quite well. We know our assets and our liabilities. We know what it's like to work on as a team. And I think that's really important. And that was really a non-negotiable for me when I started Circa, is I know I didn't want to do anything alone. And in this industry, it doesn't matter if you're making a clinical decision or a compliance decision or a business decision, which all are extremely important because people's lives are at stake. Then I don't think those decisions should be made in a vacuum at all. And so having a team and working with our clients and all that, I believe we're just that much more capable of providing good consulting and good quality service. And so anyways, what we do is we help our clients. They're essentially either existing behavioral health care centers that are looking to tune up their compliance programs and have ongoing compliance services with us. What that looks like is fractionalizing the service so we can act as fractional compliance officers and help track everything. And one of the things I was asked for over the years was a compliance calendar, and it's just because you have your daily, you have your monthly, you have your quarterly, you have your annually things that are due. And so I actually know a friend of ours that developed one and he sells them on Amazon, which I think is amazing. But what we did was we took that the things that are due during those time frames, depending on what compliance you're up against, and put it into a software system that just helps us and our clients track when things are due, and pretty much just is a accountability tool. Because as you know, when you're doing compliance or you're accredited or you're licensed or whatever, we all kind of know there's things due, and then gosh, it's a little easy sometimes to get caught up in the day to day, and it's great focusing on the clients, but oftentimes sometimes those things get overlooked that need to be continuously documented. So that's like ongoing compliance, and then we also help organizations grow or expand. And so a lot of existing behavioral health care centers have wanted to move into different services. Like, for example, if they're just doing substance use disorder, they have the desire to do mental health, but they don't, know what that looks like from a licensing perspective or even a program development perspective. And so we can help them put all that together and make sure they get the right staff and advise them so they can expand their services into something that they're not doing already. Same thing with population. So if they're treating an adult, they like to treat children, or vice versa. And then even expanding into the state or out of the state. We've helped organizations do that as well. And then last but not least, we get the calls of people that just want to open a treatment center that may not know the field and whatnot. And I got to tell you, we vet those calls very, very closely. We certainly don't just help anybody, but it is a good opportunity if we believe that they'll provide value and their heart's in the right places. And this is after many, many meetings, then we'll initiate the bring in the help to kickstart their operations, and we kind of call it startup operation services. And those clients, they need a lot because it's difficult to open a behavioral health care center. And so, but we've got enough support from all those different areas of expertise that we can help them with their startup services.
And you spoke about early on in your career, you're sort of like given the task of managing CARF. And in my career too, I sort of will manage Joint Commission or manage the state or do this sort of like another duty as assigned is what happens to compliance. Some lucky person in the facility gets it as their added on job. What's the benefit of outsourcing compliance or having folks like Circa do it as opposed to giving it to someone else as an extra duty? How do we help them?
Yeah, exactly. It's just that it's helping so that they can focus in on their regular duties. So it's not to, hey, Circa does all of our compliance for us. It's that we've got that support, that accountability, and making sure that it's done. And we're welcome to do much of it. But and a lot of what we do sometimes is training, because as you know, there are turnovers. Or there is turnover in organizations, and so if the person who's doing it switches, then we can come in and train them and work with them, and do weekly phone calls to get them up to speed. And that's the thing about compliance. And you learned, but I learned through the CARF manual originally, and then reading the regulations and reading the standards and really learning a lot, what not to do, and nobody gets hurt in the process. But anyways, there's no school that teaches you this stuff that I'm aware of. And so we do a lot of teaching, a lot of training and support. And so it allows, it doesn't matter really the size of the organization, because even like myself, I oversaw the compliance at my treatment center and I needed help, so I hired a consultant to come in and help me, revamp our policies and procedures, to, help us navigate through any compliance waves that we would have. So state inspections or new applications or, application that I wasn't familiar with. or going through a survey, some type of
Mhm.
accreditation survey. So yeah, that's what we get to do now is I really believe we give our clients confidence to be able to walk through that
Mm.
stuff. And
Mm.
because it's scary, and there's a lot at stake, especially with accreditation. We really, whether we're in network or out of network, for the most part, need that to be able to
Mm.
bill
Mhm.
insurance and to keep that gold seal and all of that. And then of course state licensing,
Yeah.
if required. If you don't have that, can't provide the services. So
That's
yes,
right. Yeah, in
we
our
give.
years of experience, the clients have become more acute, families have become more complicated, the world is more complex from payers to regulators. And I love that we get to kind of be a trusted partner to them. Like we'll take this off your shoulders or we'll support you in that or guide you through this, whatever level of help you need, we can be very flexible in that.
Absolutely. Yeah, absolutely. Yeah, there's not really one size fits all,
Hmm.
but
Hmm.
but that compliance calendar doesn't change, so it's just a matter
Hmm.
of following it and getting
Yeah.
it all done. So yeah, we
Yeah.
love supporting our clients, and I believe it takes a level of stress off of them, so that and really for the CEO and the owners, that they can have the peace of
Yeah.
mind that the
Hmm.
compliance program is sound and in good hands, and not having to
Hmm.
worry about what are they going to uncover tomorrow. So
Right, right. And we know we're not in danger of being kind of hooked into the daily crises or the HR issues. We get to stay sort of out of that. So the program doesn't change no matter what's going on at the facility level. As we know, it ebbs and flows. So I love that. And we also get to be kind of fresh eyes, I think, fresh eyes and ears that sometimes when you're in a program, as we both know, you just lose sight of it. You don't see the same things anymore. So being new, we get to see things from a new perspective, much like a regulator will see
right.
it. So it's nice that we can provide that to them.
Yeah,
Very
absolutely.
good. And
Hmm.
what's the importance? We know you're a big advocate for workplace health and organizational development. What do you
Hmm.
think? How does that impact the quality and safety of a compliance program?
Well, I had my own experience with it, like I had mentioned, and then when I joined my last organization, that hotshot CEO that came in, it was one of his non-negotiables was that the number one strategic initiative of the organization was always going to be organizational health. And when he first said that, or I would speak for myself and make it personal, was kind of like, okay, well, why? And why would that always be our number one initiative? Like, what about growth, or what about tuning up the clinical program, or responding to client needs, or whatever,
Mm-hmm.
and so organizational health and workplace health, I think it's what's difficult, especially if from depending on what, if you're more right brain or left brain, but a lot of times we want to see the evidence. And so like, why would we keep this the number one strategic initiative? How is it going to help us move the ball down the road? So anyways, those are some of my questions. And then one of the reasons he did that was because the organization he left, the board of directors he was working with, um, although that was his recommendation and really non-negotiable, and he had pushed it for years, they just
Mm-hmm.
never did it. So when he came over, he said, "Hey, look, we're gonna have to do this, otherwise I'm not." And he was a great asset to the organization. So we're like, fine, okay, let's do it. Show us.
It's great.
And so he had a consultant came out that specialized in this, like you do, Maeve, and really show the organization what that looks like. And I mean, outside of and it wasn't therapy, but outside of therapy, I
Mm-hmm.
hadn't really, done anything like that before. And so here's what I learned is, and when people ask, okay, well, what is like organizational health? Um, a lot of times I think people think of, well, it's gym memberships, and it's pre-made meals available in the kitchen, and
Mm-hmm.
whatever. And that's one of, like, they have those wellness programs out there, and if the organization can afford to do that, it's amazing.
Mm-hmm.
But this is
Right.
more like really the health of the organization, but it's contingent upon the health of the employees. And
Mm-hmm.
so it's the employees really taking care of themselves. But you could say, hey, take care of yourself, and that's fine. but unless you provide them a platform and an environment and a culture to be able to do that, then permission really, then oftentimes they don't take care of themselves. And so the organizational health piece of it is doing that. It's, making it okay to take care of yourself, having, initiatives around it, having a culture, for people to take care of themselves. And over the years, Maeve, I'm sure you've seen this as well too, but we'll work with people that come from outside or outside behavioral health. And I know there's different levels of organizational health or culture out there with different industries, but I'll never forget, it was a gentleman from the finance or banking industry that came in, and he asked me one day, he said, "Hey, Devon, what's up with the staff?" And I said, "Well, what do you mean by that?" And he said, "Well, they're just, really emotional, and it's almost like they wear their emotions on their sleeves, and I end up dealing with the staff more than the clients all day long." And so the way I explained it to him is I said, "Aha, that's what we've been talking about," because I was talking to him about creating a culture of organizational health. And we explained it as, and I've heard this analogy in different arenas, but they said it's kind of like the water, having staff like that is like, swimming in the ocean with fish, and they're the fish, and they have need to be able to take care of themselves, because they're helpers and they're helping individuals. And oftentimes the people that help individuals forget to take care of themselves, when the helper has the responsibility to help themselves so that they can continue to tune up and help others. And I think that's really overlooked in our industry. And so anyways, that they got it, and they said, like, so naming organizational health is realizing that we're swimming in water and talking about the water, And so anyways, yeah, that organization, we went through, many offsite leadership meetings where we got extremely vulnerable, and subsequently took that down to the rest of the organization in terms of like how we're creating a platform around organizational health. And we had actually sent 30% of our staff to a place for for their own work to do these workshops to tune up themselves and all of that, and that was amazing. So what we saw is that it's not like they weren't taking care of themselves, but they had permission to, and so they did that more. It became a regular thing, and we had more trust and safety. We had more healthy conflict as opposed to unhealthy conflict amongst each other. We trusted each other to make decisions. We would fight fair. People weren't vying for positions and stepping on each other's toes. If anything, they would ask for help, or they would call out their employee, saying, around accountability, but do it in a healthy way. And hey, how can I help you? Because I see you're in this area or whatnot. So it leveled up accountability, and then ultimately results. And so anyways, I think it's the key to performance in behavioral healthcare. When an organization is healthy, the clients get better faster. So.
Yeah, and like other fields, probably those will be the ones to be the most profitable as well, which is the funny part. When you invest in this, you're probably even going to do better financially.
Absolutely. Yeah, that's for sure. And it's hard to measure that, but if there are some tools out there. I mean, we've been looking at them recently, to kind of measure all that, and I hope that continues to be something that people look for in the behavioral healthcare industry, is like, what is the level of organizational health? Like Joint Commission calls it culture of safety. We can call it something different, but really at the end of the day, that's what it is how safe does everybody feel to have permission to take care of themselves, and to say what they need to say in order for there to have high patient safety rates, and again for the clients to get better faster.
Yeah, and it's as healthy as we can be as a team is how healthy our clients can be, and our our teams and all that. So that's wonderful. And my slogan lately has been happy and healthy staff are ethical and compliant to provide quality and safe care. So we want to build a compliance program that helps all three of those.
Yeah, exactly. So that's the piece, is tying it back to compliance, and it starts from the top, down. If you could do all of the stuff, if the leader doesn't walk the walk and talk the talk, it's really all for naught. So that's usually where we start, as you know, is working with leadership, and then subsequently with the rest of the staff. But how that ties into compliance is, people are there's no better compliance program than having organizational health be the #1 strategic initiative. I didn't understand that when our CEO had said, hey, that's what we're going to do, but outcomes increased overall, and when people feel healthy and happy, they do their work, they the organization remains ethical, and people are enrolled, and just the outcomes are better overall, which absolutely includes compliance.
Absolutely. And it really does start with leaders, and having leaders that buy into it and support it and model it is really critical. So we'll wrap up this session by thanking you as our leader. We're very grateful to you that you're our leader and you model that for us all the time. And if we could acknowledge today is your 21 years of recovery in a few hours. So
tomorrow.
Congratulations on tomorrow.
You.
Congratulations. That's so exciting.
Thank you
so much for this time. And in future sessions, we hope to have conversation with some of our partners, some of our clients that we work with, and anyone else, any topics or folks you want to see on this conversation, let us know, and we'll be pulling them in as well. Thank you for joining us. Thanks, Devon.
Thank you, Maeve.
See you soon. Bye.
Okay. Yeah.